Hello, my friends. Happy Colorectal Cancer Awareness Month to you all. And in honor of this Awareness Month, I've actually decided to publicly share my upcoming screening colonoscopy scheduled for tomorrow at the Kensington Screening Clinic. As some of you may well know, my father was afflicted with colon cancer, which puts me and my brother at increased risk of developing the disease. So I need to be vigilant with screening colonoscopies every 3 years. A screening colonoscopy is intended for the high risk or increased risk Canadian who has a family history of developing the disease. A family history like a first-degree relative, such as a parent, sibling, or child. It's also intended for someone who's experiencing symptoms that are consistent with colorectal cancer. But for the average risk Canadian, someone who does not have a family history and is not experiencing any symptoms whatsoever, our hope is that at the age of 50, they will access their provincial screening program, the FIT, to rule out any microscopic traces of blood in their stools. My goal today is to take you through the colonoscopy prep, which truthfully is probably the most unpleasant part of the colonoscopy process, and then have you accompany me through the colonoscopy procedure tomorrow. I've already had my very light breakfast this morning, and I'm now on to my clear liquid diet for the balance of the day. This includes apple juice, yellow Jello, Gatorade, and clear broth. Yummy. I truly believe this is a small inconvenience, my friends, to help save my life. Here comes part 1 of the prep, which includes 2 tablets of the Dulcolax. This doesn't prevent you from doing anything throughout the course of the day. So I'm taking it with my beautiful glass of apple juice. Here's my apple juice. Yum. And then off to work I go, because we have a support group meeting today. Here we go. It's part 1 of Pico-Celax. Yum, yum. I'm stirring and stirring. Going to dissolve much more. I'm going to drink it, and hopefully it'll start to take effect very soon. $150 ml of water. Cheers. Okay, here it goes. It's starting. The runs start now that I've had the first part of the laxative. So it's not fun, it's crampy, yeah, and I'll be going a few times to the toilet, but it'll be all good. It'll end likely by tomorrow morning. So hi, I'm back. So I'd say that since taking the prep, the laxative, I've gone about maybe 10 times. You'll see that I've changed my clothes into something far more comfortable. Makeup has come off because I'm starting to feel a little tired. That's not surprising. Maybe even a little dehydrated, but I'm trying to stay hydrated by drinking ginger ale, apple juice, that lemon Jello, yum. And now it's time to take part 2 of the prep. So here we go. And I'm sure I'll continue to go. But again, it's all worth it, my friends. It's all worth it. And it's a minor inconvenience. Knowing that this could potentially catch polyps. Maybe it'll catch nothing, because I really haven't ever had a polyp detected. So here we go. Hi, my friends. So we've come to the end of the day. There have definitely been multiple bowel movements, very loose bowel movements. My butt's a little sore, that's for sure. It's time to go to bed. And the worst part is over. I'm very much looking forward to tomorrow morning bright and early, because undergoing the colonoscopy means I'm going to receive the best sleep ever, knowing that I'm going to be undergoing propofol. So I wish you all a good night, and I look forward to actually seeing you tomorrow morning as we go to the Kensington Screening Clinic to undergo my colonoscopy. See you tomorrow morning. Good night. Welcome to Philomena's colonoscopy day. It's really, really early in the morning. It was a pretty rough night because I just kept going to the bathroom. So hopefully it stopped. It's really, really early this morning. It's about 5 a.m. I'm getting ready to head on out downtown and have a really great colonoscopy. So stay tuned. As soon as we get to the Kensington Screening Clinic, I'll loop you back in. Okay, my friends? So let's go have a great colonoscopy. Bye. So we're here. We've just arrived, and I'm about to go on in and check in and then wait to be called for my colonoscopy. So hang tight, guys. So I've registered and I'm just waiting to be called in, and I just wanted to bring to your attention that the Kensington Screening Clinic is a big supporter of this year's and every year's annual bum run. Just to give you a little peek at the fact that they are advertising this year's bum run. Outstanding. They're actually one of the beneficiaries of the event, but we can't be more proud of the fact that they're advertising the event, and I'm hoping that everyone will come on out and participate in this year's bum run. So come on out, my friends, participate, advocate for the fact that anyone over the age of 50 should be getting screened, and if you are experiencing symptoms, please let your primary care physician know that you are, and perhaps you should be accessing a colonoscopy. So here we are. We are in, we are dressed, and we are ready to go in. So, I'm getting an IV.
Deep breath for me, please. Deep breath, middle in. I'll be very gentle. That's it, it's done.
And the IV is in. Look how great they are. They're so awesome. 3 seconds.
Take here and you're ready, okay?
Perfect. Thank you. So meet Hilda.
Hi, hello.
A wonderful GI nurse, the endoscopy nurse, who's going to be assisting Dr. Elfassi. She's lovely.
All right.
Okay, so meet the extraordinaire Dr. Sam Elfassi, my gastroenterologist for many years now. Dr. Elfassi is going to be performing my colonoscopy today. And I have to tell you, my friends, he's just wonderful. So Dr. Elfassi, would you kindly introduce yourself properly?
Yeah, of course. Well, welcome to Kensington. I'm Dr. Sam Elfassi. I'm a gastroenterologist at St. Joseph's Health Center, Unity Health. And also I perform procedures here at Kensington Screening Clinic. So we bring a lot of our patients who are usually very well and healthy to Kensington to help if some people need special sedation where they're completely asleep, or if they're a bit anxious about coming to the hospital. And also it's a great facility where we can bring people in a lot quicker, so there's not a long wait list, so then you have to wait around too long, especially if you're having symptoms or you're concerned about coming to the hospital.
Yeah, so you've just highlighted some of the benefits of coming to a clinic like the Kensington Screening Clinic. Dr. Elfassi, can you highlight maybe a few others, for example?
Sure. You know, we have all the physicians here are all, excellent and certified and have been screened before they come here. All the staff, the nursing staff, everyone's been trained and very experienced at doing a lot of these procedures, and it's a very high volume clinic, which is very important. When you have your procedure, you want it done by teams who are very familiar with doing this. It's also really a very convenient location for a lot of patients, and parking and getting here and transit makes it very simple, and and that also helps bring people so they don't have to wait too long, because sometimes at the hospital our wait list could be up to a year long.
Yeah, precisely. And so I'm going to be undergoing a screening colonoscopy today, Dr. Alfasi. Do you think you can take us through, especially our viewers, through the procedure quickly before we actually get started?
Yeah, of course. Well, I think you did all the hard part already, which was the clean out, and that was happening last night and this morning. Now, when you come into the clinic, you get an IV put in, and that's going to help us give you the sedation. You get all your vitals checked, and we make sure you're nice and ready and stable. And then the anesthesiologist is going to give you some sedation and make you sleepy. And then I pass the camera for the colonoscopy. We go from obviously the bottom end. We take a look all the way around the colon, and I'm checking for things that look abnormal to me. Inflammation. We take a very careful look for little polyps or larger polyps, of course. And the nice thing with colonoscopy is we can intervene on these things. So it's not just a regular screening check which just says, oh, there might be a problem. If we see the problem, we can intervene. And not all polyps become cancers, but all cancers started as a polyp. So if we remove those polyps, we actually prevent colon cancer, and that's the key.
Terrific. Excellent. Okay. And so on site, we also have an anesthesiologist. Is that correct, Dr.
We do.
All right. And has our anesthesiologist joined us today?
I've arrived.
Hello.
How are you? My name is Dr. Yang.
Hello, Dr. Yang. It's lovely to
Nice
meet you.
to meet you.
And so you're going to be administering propofol. Is that correct?
That's correct.
That is the best med, because I'm going to be receiving the best sleep ever.
That's
correct?
amazing. I'm so happy to meet you.
It's lovely to
What
meet
do
you
you do
as
for a
well.
living? Let's start with that. I may have missed the beginning, but you tell me what you do for a living.
So I'm the president and CEO of a national colorectal cancer patient advocacy group, Dr. Yang.
Amazing.
Which is why I'm putting myself out there today, because we're trying to encourage colorectal cancer screening for the average risk Canadian, so accessing FIT. But for those who are at increased risk or greater risk, we're trying to encourage going to see their family doctor if they're experiencing symptoms that are consistent with colorectal cancer, so that if colonoscopy is in order, let's get them to a colonoscopy.
You are amazing. I'm so happy to hear. So I'm going to ask you some questions
Bet.
with regards to anesthesia. And this is very standard. We ask the same kind of questions to all the patients, okay?
Sure.
So the first question, we obviously care a lot about patients' experience. So I tend to ask them what they do for a living. And the first question I ask you is, have you had anesthesia before?
I have.
And how did that go?
It went okay, except for maybe one time when I underwent
Right.
surgical resection for
Okay.
a uterine septum.
Right.
I had that invisible itch
Right.
at the end of it all.
Right.
It lasted a couple of days, and I'm no longer a candidate for that particular, I guess, that particular formulation that they administered.
Right. And you have no drug allergies.
Sulfa, Demerol.
So we won't give you any of that today, okay?
Yep.
So the main anesthesia I use is propofol. I do use a little bit of pain medication. We call it remifentanil. It's a very short-acting medication just to keep you comfortable, okay? The first thing is I'm going to ask you is, when was the last time you had any solid food?
Yesterday morning, a very, very light breakfast
Okay.
at 7 a.m.
You must be hungry.
No, not really.
So the perks of you finishing this procedure is we're going to feed you some snacks after,
Sounds
okay?
good to me.
When was the last liquid?
I had a sip of water with my meds at 5 a.m. this morning.
Okay, and that's it.
That's it.
So it's been more than 2 hours since the last clear liquid you had.
Mm-hmm.
Okay, and you never had any issues with anesthetics. So I
No.
hope that this time I don't anticipate any problems. Okay, you have any pain anywhere right now?
No,
You have any dental work that was done recently?
no,
Okay, and do you drink or smoke?
no,
None of that.
no. Social drinker,
Right.
half a glass of wine, that's it.
And how's your exercise tolerance?
Yeah, no, not very. I lead pretty much a sedentary lifestyle, Dr.
Okay.
Yang, but because of my job, right?
That's okay. And do you have any questions or concerns about the anesthesia from your perspective?
No, not really.
Okay. So my priority as the anesthesiologist, and as for all the listeners and people watching, is that our key really is to keep her safe. So I would say your safety is the paramount when it comes to anesthesia. The second thing would be your comfort, right? So you're going to have 2 procedures done, one for the upper, one for the lower. For the upper part, we tend to sedate you a little bit deeper, and because all of us humans have a natural gag reflex, and that can be very uncomfortable. So with any kind of anesthesia, there are risks. We can talk about the detailed numbers in the footnotes. However, I want to tell you it's exceptionally safe in the alt clinic setting. We do a great job screening patients. I screen all the pre-op just to make sure people are safe when they're coming in. I want to make sure people are fasting. And the last thing I want to say to you is obviously you've never had any issues with the anesthesia, so I don't anticipate any issues. Some of the common side effects from the anesthesia is low blood pressure. So in your case, your blood pressure is actually excellent. So I don't have any concerns about that. That's something I'm going to be watching for. The second thing is, most common things is, what if you stop breathing? And that's what a lot of people ask me. I think because the procedure is relatively short and we monitor you and we give you an oxygen to help you breathe, I think the chance of that happening is low. However, I'll do my best with the monitor just to keep and make sure that you're safe. Okay?
That sounds good to me.
All right. Any other questions?
No, let's.
Right. And the last thing I want to tell everybody is, if something happens we can't deal with at the clinic, we send you to the hospital where we provide you with exceptional care. But rest be assured, we worked there for a long time and we haven't had any significant issues with sending patients. And it's just something I tell all my patients. Okay?
That's great.
Awesome. Any
All
further
right.
questions? We're going to talk about some personal stuff. But other than that, we're all done.
We're good.
Awesome.
Thanks, Dr. Yang.
Hey, no problem.
And thanks, Dr. Alfassi.
My pleasure.
Thank you.
You're welcome.
All right, let's go.
So I'm out. Gastroscopy, colonoscopy completed. I'm waiting to hear back from Dr. Alfassi. See what he found, and then we'll move forward. That was the best sleep ever, guys. Propofol is terrific. And I feel a little woozy, but all good. So good. Definitely tired. Looking forward to having some apple juice. Ah, here it is. Here it is. Here's my apple juice.
Good morning, my friends. It's the day after my colonoscopy, and I am most definitely feeling more lucid and recovered from the general anesthetic. I am so pleased to share that my colonoscopy revealed no polyps and no cancers, for which I am so grateful. I'd like to extend my sincere thanks to the staff at the Kensington Screening Clinic who took such great care of me. In particular, Drs. Alfassi and Yang, who were truly patient-centric and did such a great job of being interviewed. They were real sports. My goal of sharing my colonoscopy experience with you all, my friends, was to essentially demystify the whole experience, so that if anyone is experiencing symptoms that are even remotely resembling those consistent with colorectal cancer, I urge you to contact your family doctor and share those symptoms with them, so that those symptoms can be addressed in a very thoughtful manner. Being referred to a GI specialist who will determine if proceeding to a colonoscopy is right for you, it could actually save your life. And if you are 50 years or older and not experiencing symptoms and do not have a family history, we at CCRAN urge you to access the FIT, a fecal immunochemical test, which looks for microscopic traces of blood in your stools that you can actually perform in the comfort of your own home. Please visit the CCRAN website for more information, or contact us should you require more of that information. And finally, if you haven't already heard, CCRAN CCRAN is participating in Bum Run once again this year, an annual 5-kilometer walk, run to promote colorectal cancer screening and prevention. Yes, it's a huge mandate for us to ensure we get as many Canadians screened as possible. The event is taking place in Toronto, Halifax, Calgary, Vancouver, and we actually have a virtual site too. Please consider registering for the event should you happen to live in one of those cities or close by. Or sign up virtually. It's really, really easy. If not, please consider donating to my Bum Run page. Just visit thebumrun.com. This year's Bum Run promises to be the best ever. We will be hosting our Jumbo Colon again at most sites, and the event is oh so fun-filled and very family-oriented. So come on out and generate funds for CRAN's patient programs. Finally, we at CRAN wish you all a happy and healthy Colorectal Cancer Awareness Month. Screen it, treat it, beat it. Together, anything is possible. My very best to you all.